Welcome to Book Buzz Reviews and Summaries. Imagine living in a world where chronic pain no longer controls your life, a world where you reclaim not just your physical health, but your emotional and mental well-being too. Welcome to Back in Control by Dr. David Hanscom, a spine surgeon who's walked away from traditional methods to offer a revolutionary approach to chronic pain management. In this remarkable book, Dr. Hanscom doesn't just treat the symptoms, he gets to the root of the pain. With decades of experience and personal insight, he unveils a holistic, mind-body strategy that challenges the conventional wisdom of pain treatment. But here's the kicker, it's not about more surgeries or stronger medications. It's about empowering you to take control of your healing journey. From understanding the neuroscience of pain to practical steps you can take right now to regain your life, this book is a lifeline for anyone who's been trapped in the endless cycle of chronic pain. Whether you've tried everything or are just starting to seek relief, Back in Control offers a roadmap to freedom. Ready to embark on a journey that could change your life? Let's dive into Dr. Hanscom's groundbreaking guide to taking back control. Introduction: A journey from the operating room to healing. In Back in Control, a spine surgeon's roadmap out of chronic pain, Dr. David Hanscom invites readers on a transformative journey. A journey that begins in the sterile environment of the operating room and leads to a place of deep personal healing. As a renowned spine surgeon, Dr. Hanscom spent decades performing complex surgeries, striving to alleviate the crippling pain that plagued his patients. But over time, he came to a startling realization: surgery was often not the answer. The true solution to chronic pain lay not in the operating room but in the intricate interplay between mind and body. The book is a deeply personal narrative, woven with stories from Dr. Hanscom's own life and the lives of his patients. It's a story of frustration and failure, of discovery and triumph. But most importantly, it's a roadmap, a guide for anyone trapped in the relentless grip of chronic pain, showing them the way out. In this review, we'll explore the key themes and insights from Back in Control, delving into the powerful ideas that Dr. Hanscom presents. We'll walk alongside him as he challenges the traditional medical model, advocates for a holistic approach to pain management, and ultimately offers a message of hope to those who have lost all hope. This review will not only analyze the book, but will also immerse you in the narrative, inviting you to experience the journey of healing as if you were one of Dr. Hanscom's patients. Chapter 1: The Frustration of Modern Medicine. Dr. David Hanscom's journey begins with frustration. As a spine surgeon, he was trained to see the human body as a machine, one that could be fixed with the right tools and techniques. For years, he performed surgery after surgery, meticulously correcting deformities and stabilizing spines. But something was wrong. Despite his best efforts, many of his patients continued to suffer. The surgeries, which were supposed to bring relief, often led to more pain. It was as if the very act of surgery was amplifying the problem rather than solving it. In this opening chapter, Dr. Hanscom paints a vivid picture of the medical world, a world driven by procedures, where patients are often reduced to a set of symptoms and diagnoses. He describes the pressure to operate, the financial incentives that drive surgical interventions, and the sense of helplessness that comes when the expected outcomes fail to materialize. But it wasn't just his patients who were suffering. Dr. Hanscom himself was battling chronic pain, anxiety, and insomnia, a triad of symptoms that seemed immune to his medical expertise. This personal struggle became the catalyst for his quest to understand the root causes of pain, leading him to question everything he had been taught. Through powerful storytelling, Dr. Hanscom introduces us to the concept of mind-body syndrome or MBS, a condition where emotional and psychological stress manifests as physical pain. He shares the stories of patients who were trapped in a cycle of fear and pain, their bodies responding to emotional trauma with physical symptoms. These stories are not just case studies, they are narratives of human suffering, resilience, and ultimately, healing. The frustration that Dr. Hanscom felt, the frustration that so many patients feel when they are not heard, when they are not healed, is palpable. It sets the stage for the rest of the book, where he begins to unravel the mysteries of chronic pain and offers a new path forward. Chapter 2: The Neuroscience of Pain. As the narrative progresses, Dr. Hanscom delves into the science behind pain, particularly chronic pain. He takes readers on a journey into the brain, exploring the complex networks of neurons that transmit pain signals and the ways in which these signals can become distorted. This chapter is where Dr. Hanscom's expertise as a surgeon and his deep understanding of neuroscience truly shine. He explains how pain is not just a physical sensation but a multifaceted experience influenced by emotions, memories, and perceptions. The brain, he reveals, is a powerful organ, capable of both creating and alleviating pain. One of the key insights in this chapter is the concept of neuroplasticity, the brain's ability to change and adapt. Dr. Hanscom explains how chronic pain can become wired into the brain, creating a vicious cycle where the pain becomes self-perpetuating. But just as the brain can learn pain, it can also unlearn it. Through engaging anecdotes and clear explanations, Dr. Hanscom breaks down complex scientific concepts into understandable ideas. He describes how stress and negative emotions can amplify pain, while positive experiences and mindfulness can help rewire the brain for healing. This chapter also introduces the idea of pain pathways, the neural circuits that are activated in response to pain. Dr. Hanscom explains how these pathways can become overactive, leading to a state of hypervigilance where the body is constantly on high alert. This state, he argues, is at the heart of chronic pain. The neuroscience of pain is a critical foundation for the rest of the book. It provides the scientific backing for the holistic approach that Dr. Hanscom advocates, showing that healing chronic pain is not just about treating the body but also about addressing the mind. Chapter 3: The Role of Stress and Emotions. Building on the neuroscience of pain, Dr. Hanscom explores the powerful role that stress and emotions play in chronic pain. He draws on his own experiences, both as a doctor and as a patient, to illustrate how deeply interconnected our mental and physical health truly are. This chapter is rich with stories of patients who, despite undergoing multiple surgeries, continued to suffer from debilitating pain. What these patients had in common was a history of unresolved emotional trauma that manifested in their bodies as chronic pain. Dr. Hanscom discusses the concept of emotional repression, where buried emotions like anger, fear, and sadness express themselves physically when they are not acknowledged or processed. One of the most compelling aspects of this chapter is Dr. Hanscom's honesty about his own struggles. He describes how his own unrecognized stress and anxiety contributed to his chronic pain and how his journey to healing required him to confront these issues head-on. His vulnerability adds depth to the narrative, making it clear that this is not just a theoretical discussion but a lived experience. Dr. Hanscom also introduces readers to the adrenaline rush that comes with chronic stress. He explains how the body's stress response, while useful in short bursts, becomes harmful when it is constantly activated. This chronic state of fight or flight not only exacerbates pain but also leads to a host of other health problems, including insomnia, anxiety, and depression. The role of stress and emotions in chronic pain is a central theme of Back in Control. Dr. Hanscom argues that without addressing the emotional and psychological components of pain, true healing is impossible. This chapter sets the stage for the practical strategies that he will introduce in the following sections, offering a clear understanding of why these strategies are necessary. Chapter 4: Unpacking the Tools for Healing. With the groundwork laid, Dr. Hanscom shifts from theory to practice. This chapter is where Back in Control becomes a practical guide, offering readers a comprehensive toolkit for healing from chronic pain. Dr. Hanscom emphasizes that this is not a quick fix, but a process, a journey that requires commitment, patience, and self-compassion. One of the first tools he introduces is expressive writing, a technique where patients are encouraged to write about their deepest thoughts and feelings. Dr. Hanscom explains that this simple act of writing can help to unearth repressed emotions and bring them to the surface, where they can be processed and released. He shares the story of a patient who, after months of writing about his anger and frustration, experienced a significant reduction in pain. This story is one of many that illustrate the power of expressive writing as a tool for emotional healing. Another key tool in Dr. Hanscom's arsenal is mindfulness. He discusses how mindfulness practices, such as meditation and deep breathing, can help to calm the nervous system and break the cycle of chronic pain. He shares his own experiences with mindfulness, describing how it helped him to manage his anxiety and reconnect with his body. The chapter is filled with practical advice on how to incorporate mindfulness into daily life, making it accessible to readers who may be new to the practice. Dr. Hanscom also emphasizes the importance of physical activity in the healing process. He discusses how gentle movement, such as walking or yoga, can help to release tension and improve overall well-being. He shares stories of patients who, after years of avoiding physical activity due to pain, found relief through regular exercise. These stories are inspiring and offer hope to readers who may feel trapped by their pain. In addition to these tools, Dr. Hanscom introduces the concept of pacing. He explains that many chronic pain sufferers tend to overdo it on good days and pay the price on bad days. Pacing, he argues, is about finding a balance, learning to listen to your body and respect its limits. This approach helps to prevent flare-ups and supports long-term healing. This chapter is a turning point in the book. It shifts the focus from understanding pain to actively doing something about it. Dr. Hanscom's approach is holistic, addressing not just the physical aspects of pain but also the emotional, mental, and even spiritual dimensions. It's a comprehensive roadmap that empowers readers to take control of their own healing journey. Chapter 5: The Power of Community and Support. In this chapter, Dr. Hanscom explores the critical role that community and support play in the healing process. He argues that chronic pain can be an isolating experience, but it doesn't have to be. By connecting with others who understand their struggles, patients can find comfort, encouragement, and strength. Dr. Hanscom shares the story of a support group he started for his patients, an informal gathering where they could share their experiences, offer advice, and simply be there for each other. He describes how these meetings became a lifeline for many of his patients, helping them to feel less alone in their pain. The group not only provided emotional support but also created a sense of accountability, motivating members to stick with their healing practices. The chapter also discusses the importance of involving loved ones in the healing process. Dr. Hanscom emphasizes that chronic pain affects not just the individual but also their relationships. He shares stories of patients whose marriages were strained by their pain, but who found new closeness and understanding when their partners became involved in their healing journey. One particularly powerful story is that of a woman who had been in chronic pain for years, which had taken a toll on her marriage. Dr. Hanscom encouraged her to involve her husband in her treatment plan, and the results were transformative. As they began to communicate more openly and support each other, her pain levels decreased, and their relationship strengthened. This story illustrates the profound impact that a supportive partner can have on the healing process. Dr. Hanscom also touches on the importance of professional support. He encourages readers to seek out healthcare providers who are open to a holistic approach and who will work with them as partners in their healing journey. He acknowledges that finding the right provider can be challenging, but emphasizes that it is worth the effort. The power of community and support is a recurring theme in Back in Control. Dr. Hanscom believes that no one should have to face chronic pain alone, and this chapter offers practical advice on how to build a support network that can help to facilitate healing. Chapter 6: The Road to Recovery, Real-Life Success Stories. As the book draws closer to its conclusion, Dr. Hanscom dedicates an entire chapter to success stories, real-life examples of patients who have successfully navigated their way out of chronic pain using the principles outlined in Back in Control. These stories are a testament to the effectiveness of Dr. Hanscom's approach and serve as a source of inspiration for readers who may be struggling with their own pain. One of the most compelling stories is that of a man named John, who had suffered from debilitating back pain for over a decade. John had undergone multiple surgeries, tried countless medications, and seen numerous specialists, but nothing seemed to work. He was on the verge of giving up when he discovered Dr. Hanscom's book. Through a combination of expressive writing, mindfulness, and gradual physical activity, John was able to significantly reduce his pain and reclaim his life. His story is a powerful reminder that healing is possible, even for those who have been in pain for many years. Another inspiring story is that of a woman named Sarah, who had been diagnosed with fibromyalgia. Sarah's pain was so severe that she could barely get out of bed, and she had lost all hope of ever feeling better. But after reading Back in Control, she began to address the emotional trauma that had been contributing to her pain. Through therapy, mindfulness, and the support of her family, Sarah was able to break free from the cycle of pain and start living again. These stories are not just about physical recovery, they are about personal transformation. Dr. Hanscom emphasizes that healing from chronic pain often involves a shift in mindset, a willingness to let go of old patterns and embrace new ways of thinking. For many of his patients, the journey out of pain was also a journey of self-discovery, where they learned to reconnect with themselves and their lives in meaningful ways. The success stories in this chapter serve as a beacon of hope for readers. They show that no matter how long someone has been in pain, there is always a path forward. Dr. Hanscom's patients are living proof that the principles outlined in Back in Control can lead to profound healing and a renewed sense of purpose. Chapter 7: Embracing a New Perspective on Pain. In the final chapter of Back in Control, Dr. Hanscom brings everything full circle, encouraging readers to embrace a new perspective on pain, one that sees pain not as an enemy to be fought, but as a signal from the body that something deeper needs attention. He reflects on his own journey, from a surgeon who believed in the power of the scalpel to a healer who understands the complexity of the mind-body connection. Dr. Hanscom acknowledges that his views may be challenging for some, particularly those who have been conditioned to see pain as purely a physical phenomenon. But he urges readers to keep an open mind and to consider the possibility that healing is not just about treating the body, but also about addressing the mind and spirit. This chapter is both philosophical and practical. Dr. Hanscom discusses the importance of self-compassion, encouraging readers to be gentle with themselves as they navigate their healing journey. He also emphasizes the importance of patience, reminding readers that healing from chronic pain is a process that takes time. Dr. Hanscom ends the book with a message of hope. He believes that everyone has the capacity to heal, and that the tools and principles outlined in Back in Control can help anyone to find their way out of chronic pain. He encourages readers to take control of their own healing journey, to trust in the process, and to believe in their own ability to heal. Conclusion: A new paradigm for pain management. Back in Control, A Spine Surgeon's Roadmap Out of Chronic Pain, is more than just a book, it's a movement. Dr. David Hanscom challenges the traditional medical model, offering a new paradigm for pain management that is holistic, patient-centered, and rooted in the understanding that the mind and body are deeply interconnected. The book is a testament to the power of personal experience. Dr. Hanscom's own journey from surgeon to patient to healer gives him a unique perspective that resonates with readers. His honesty, compassion, and deep commitment to helping others shine through on every page. For anyone struggling with chronic pain, Back in Control offers not just a roadmap, but a lifeline. It provides practical tools, inspiring stories, and a message of hope that is sorely needed in a world where chronic pain is often seen as something to be endured rather than healed. This review has only scratched the surface of the rich content in Back in Control. The book is a must-read for anyone who wants to understand the true nature of chronic pain and learn how to take control of their own healing journey. Dr. Hanscom's approach is revolutionary, and his message is clear: healing is possible, and it begins with you. Read the book to learn more, and if you enjoy my content, consider subscribing to support the channel and stay updated on future uploads. Thank you.